We have a few more people trickling in, so I'll give them a few minutes to come and sit down. All right, thank you guys all so much for being here. My name is Anna Powell. I am the Chautauqua Lead coordinator for our program at the health department. And we are kicking off 2025 National Lead Poisoning Prevention Week. So I would like to introduce Lacey Wilson, our public health director, and she's going to come up and say a few words.
Thank you, Anna. Are these mics okay? I'll stand up tall. I'll stand my tip. Good afternoon, everyone, and thank you so much for being here with us today. This is a wonderful group of people, a lot of support here, which is always wonderful to see. Thank you for coming out in the rain, which in the health department is something we are also very thankful and excited about. We have a number of communities experiencing drought, so despite the rainy weather, we are very excited about that. It is both an honor and a privilege to welcome you all here as we formally recognize Lead Poisoning Prevention Week here in Chautauqua County. First, I would like to extend my deepest gratitude to our elected officials. We have both legislators and our county executive will be speaking today, so thank you for taking your time to be here with us. Also, our other municipal leaders, City of Jamestown officials, our community partners, I see friends from JCLC, and our local healthcare providers. Dr. Paul Robbins will also be speaking with us today. So because of your commitment to the health and well-being of our residents, especially our children, that is what makes today possible. I'd also like to extend a thank you to the dedicated staff of our health department's lead poisoning prevention team, who I have the distinct pleasure of working alongside. You have turned concern into action, and action into progress. Our communities are measurably safer from lead poisoning because of your efforts. Our communities really deserve this sort of effort, and you give it every single day. I see your perseverance each day, your willingness to take on the difficult conversations, and your willingness to advocate for the most vulnerable in our communities. As your colleague, but more importantly as a mom myself of 3 young children, I am sincerely thankful for your unwavering commitment to improving the lives of our children, our families, and our neighbors. Thank you for living the mission of our department to prevent illness and to promote and protect the health of our communities. Lead poisoning is one of the most preventable environmental health issues we face. Yet the reality is that it remains a pressing threat, particularly in communities like ours with older and deteriorating housing. Nearly 8 out of 10 homes in our county were built before lead paint was banned in 1978. And in the cities of Jamestown and Dunkirk, that number rises to 9 out of 10. With time, as paint deteriorates, the risk to our youngest residents only grows. In fact, the primary cause of lead exposure in Chautauqua County is the dust from lead-based paint, a hazard that lingers in the very homes where families should feel safest, where our children, grandchildren, students, and neighbors should be growing and developing in healthy and strong environments. It cannot go without saying then that, this last year, 8 out of 10 children with lead poisoning in our county lived in rental housing. And while Jamestown makes up just 22% of our county's population, it accounts for nearly 3/4 of our lead poisoning cases. Every year, about 60 children in Chautauqua County are identified as lead poisoned. So if you can picture that, that's almost the equivalent of 4 full elementary school classrooms. And another, about 20, hover just below the state's action threshold. So while there is an action threshold, the reality is there is no safe level of lead in our bodies. Research tells us that even levels as low as 2 micrograms per deciliter can lead to measurable decreases in a child's academic performance, lead to difficulty managing behavior, and emotional dysregulation. Understanding these numbers and the data is, of course, central to the work that we do and our lead poisoning prevention team does, because it allows us to measure our continued progress, which is a wonderful thing. But more importantly, these numbers are important because each one of them represents a real child, real families, our neighbors, whose futures are being altered by something entirely preventable. The consequences of lead exposure are lifelong, like we had noted before, affecting learning, behavior, and health. But we need to also be aware that there is a staggering economic consequence that occurs as well. It's estimated that statewide, lead poisoning costs over $6 billion in healthcare, special education, mental health intervention, lost productivity, and premature death. So the realities of lead poisoning are certainly grim, but the future in prevention is very bright. While we're gathered to raise awareness of the toll this has taken on our community, today also marks the moment in time in which we say, this is enough. This no longer will be a story of despair, but today we turn the page to progress and our continued progress, the continued work that we have been doing in our communities. Today is a call to action, to prevention, and to health promotion. Our goal is clear and achievable: to prevent every child and every resident from suffering the effects of lead poisoning, and to also promote the health of each and every resident in our county. To reach that goal, it will take all of us: public health, local government, realtors, landlords, tenants, contractors, and neighbors, working together to make every home a safe home. We have the tools, we have the knowledge, and thanks to all of you here today, we have the will. As we mark this week, let's recommit ourselves to the belief that no level of lead is safe, and that no child should ever be asked to pay the price for where they live. Let's continue to strengthen partnerships, invest in safer structures, improve our housing standards, and empower residents with the information they need to protect their families. Every test we conduct, every home we make lead safe, and every child we protect brings us step by step closer to a healthier, stronger Chautauqua County. Thank you sincerely, all of you, for being a part of this effort and for leading with compassion, courage, and conviction. Together we can and we will end lead poisoning in our community. Thank you. With that, I have the distinct honor of welcoming Dr. Paul Robbins of the Chautauqua Center, who is a pioneer pediatric provider in our county, specifically with lead screening and diagnosis. So we are definitely a friend to Dr. Paul Robbins.
Thank you very much. Thank you everyone for being here. I know environmental health is not a very popular topic to discuss, but it is very important. And I am here today because I care deeply about the health of the children in our community. Lead exposure remains one of the most persistent and preventable environmental health threats to children. It seeps quietly into their daily lives through old paint, aging plumbing, and the very dust around us. And its impact can be profound. Once it enters a child's body, it interferes with how they learn, how they grow, and even how they will think. The truth is simple. There is no safe level of lead in a child's body. Even a very, very small amount. I was given a prop, actually, to demonstrate this point. I'm sorry. So I'm going off script a little bit. And so we talk about what a microgram per deciliter. It's a very small amount, correct? And so the math I did last night was actually a single grain of sand it would be the equivalent of a 5 microgram per deciliter dose in an 18-month-old child. It's a very, very small amount. Lead is very persistent in the environment. It's hard to get rid of once it's there. And that's why becoming aware of its presence and testing is so important. Those small levels as low as the 2 micrograms have been associated with those decreased academic performance and lifelong challenges. However, there is good news. The good news is this is a completely preventable issue. We can stop the lead exposure before it harms the kids. This begins with awareness and it proceeds to action. A simple blood test can check your child's lead level. It's quick, it's easy, and it can have a lifetime of difference. If a child does have an elevated lead level, there are things we can do immediately to make their home and their environment safer. So today, I'm asking every parent, grandparent, caregiver, please get your child tested and encourage your friends and neighbors to do the same. Every child deserves to grow up healthy, strong, and ready to learn. Together, we can make that happen. Let us keep our children and community lead-free. Thank you.
Thank you so much, Dr. Robbins. And I now would like to introduce Joseph Calamari from City of Jamestown Mayor's Office.
All right. Well, good afternoon, everyone. Thank you for joining us here at City Hall as we recognize the start of National Poisoning Prevention Month. Mayor Eklund, unfortunately, is unable to be with us today due to a prior commitment, but she sends her well wishes and her full support for this important initiative. So I'd like to start out by extending our sincere appreciation to the Chautauqua County Health Department and the Healthy at Home CHQ Coalition for their ongoing leadership and collaboration. Their dedication to education, outreach, and prevention continues to make a meaningful difference in the lives of families across our community. Lead poisoning remains a serious public concern, especially here in Jamestown. As Lacey had mentioned, 90% of our housing was built before 1978, which was the year that lead-based paint was banned for residential use. So as a result, many of the homes in the cities and many of the families who call these homes their dwellings continue to face risk of lead exposure. Lead poisoning is often invisible, yet the consequences, as we've mentioned, can be lifelong. This week serves as an important reminder that awareness and prevention are our strongest tools. By working together, educating ourselves, testing our homes, and connecting residents with available resources, we can reduce exposure and protect the next generation. So, on behalf of Mayor Eklund, I am honored to present a proclamation declaring this week as National Lead Poisoning Prevention Week in the City of Jamestown, and encourage all residents to learn more about lead safety, take proactive steps to prevent exposure, and take advantage of the many community resources available, including the table here today. So thank you, everyone, for your continued support in this critical work, and together we're building a safer, healthier, and stronger Jamestown and Chautauqua County for all.
Thank you so much. Thank you so much to the City of Jamestown. And now I would like to introduce our County Executive, PJ Wendel, and he'll provide our proclamation.
Thank you, Anna. A little bit about this. So we've been fortunate enough to receive a couple of lead grants through Housing and Urban Development, HUD, and it was exciting to see. But then Anna and her team realized that there was still a gap. There were still people that weren't able to qualify, but yet still didn't have the means. So the legislature, under the guidance of our ARPA funding team, and most importantly from Pierre Chagnon, who championed this cause, making sure that one of the very first ARPA programs we designated was $700,000 to bridge that gap, or that gap funding for those who didn't qualify for our HUD program, but were not able to sufficiently fund restoration projects in their homes. So this is something that's been near and dear to us. Spending 25 years in education, children has been the lifeline of this community and always will be. So it's been an important factor, for myself and others in the legislature moving forward. So hats off to Anna and her group. If anybody wasn't, some of the people here were present last Wednesday, but we had a regional lead awareness seminar last week that was attended by the 3 neighboring counties, Allegheny and Cattaraugus, and phenomenal to see the amount of work that's being done. Unfortunately, it's work that has to be done. And as we have an older housing stock, it is more important, and as Dr. Robbins said, making sure that our children are protected is vital. So from the Office of County Executive, a proclamation proclaiming Lead Poisoning Prevention Week, October 19th through 25th, 2025. Whereas lead is a potent neurotoxin that poses significant health risks, significantly to children under the 6 years old, pregnant women, and other vulnerable populations. And no safe blood level in children has been identified. And whereas exposure to lead, commonly from deteriorated lead-based paint, lead-contaminated dust, and lead in water or soil can result in irreversible cognitive, developmental, hearing, and behavioral impairments, among other adverse health outcomes. And whereas many homes, buildings, and infrastructure within Chautauqua County were constructed before 1978 and may contain lead-based materials, placing children and families at risk. And whereas in Chautauqua County, the Health Department, the New York State Childhood Lead Poisoning Prevention Program, the Healthy at Home CHQ Coalition, and other community partners are actively engaged in outreach, testing, education, and remediation efforts to reduce and eliminate lead hazards. And whereas National Lead Poisoning Prevention Week is observed each year to raise awareness, share guidance, and mobilize community action with themes such as Get the Facts, Get Your Home Tested, and Get Your Child Tested. Now, therefore, I, Paul M. Wendel, Jr., do hereby proclaim the week of October 19th, 2025 through the 25th of 2025 shall be known in Chautauqua County as Lead Poison Prevention Week, and encourage all citizens, community organizations, public and private agencies, school districts, healthcare providers, housing authorities, and landlords and local businesses to join in our efforts. In witness whereof, I have hereto affixed my signature and caused the seal of the great county of Chautauqua to be affixed this 20th day of October 2025. So on behalf of myself and the residents of Chautauqua County, I urge everyone to please pay attention, do as much as you can to become educated, test your homes, test your children, so at one point we can say we have eliminated the lead risk here in Chautauqua County. Thank you.
Thank you all for coming today. I appreciate you being here and participating in Lead Poisoning Prevention Week. We have backpacks and door hangers if you want to get out in the community and place door hangers on some homes in your area or maybe some neighbors' areas. Please feel free to see us over at the table and we'll get you some supplies and send you out into the community so we can raise some more awareness this year. Thank you guys so much.